Hi, I'm Bill Patten, CEO at Holy Cross Medical Center. Today I'd like to give you an update on our progress providing COVID-19 vaccines to our community. I'd like to start by saying thank you to all the different partners we have in the community that have allowed this process to be developed to the state that it is today. We've moved from providing the vaccine here on the hospital campus to the Taos Middle School. So they're the first ones I'm going to thank. They've opened up their gymnasium. Actually, we're using 2 of their gyms to provide the vaccines. They've been a great host. Kit Carson has also been a wonderful partner providing internet access within the gymnasium for us. Taos County has provided leadership. A lot of the coordination, Bobby Lucero specifically, has really been great in getting the gymnasium set up so that we have good flow. The town of Taos, the Taos Pueblo, I could go on, the Taos Ski Valley, numerous businesses have supported this effort, and we're seeing on a daily basis folks that are volunteering who are coming in and helping us staff this. We have 25 to 30 people who staff the middle school every day. The registration process, the shot process, the observation process. We're also seeing support from the business in the community. They are providing snacks, they're providing free lunches for the teams. So I want to say thank you. I think this is a wonderful example of how a community can come together and meet the needs, especially in very trying times of a community. The Holy Cross team is happy to provide leadership in this effort. David Elliott and Tamara Brown have done a wonderful job. David doing the coordination, Tamara doing the pharmacy side. Jenna Delnecki has also been key in doing a lot of the registration. And I won't try and name all the people, but this has been a huge effort by the Holy Cross team. We continue to provide vaccines, but we are limited on the doses we can give based on the amount that we receive. In the early days, we were getting 30 vials a week. Now we are getting 195 vials, but not this week. There is a shortage nationally, and so the amount of vaccine that the state of New Mexico received went down dramatically. So instead of 195 vials, we received 100 vials, about half of what we had originally planned. And keep in mind that the Pfizer vaccine is a 2-shot vaccine. So whatever we give today, 3 weeks from now, we're going to have to give that second dose. This week, for example, we had about 550 of our 1,000 doses that were devoted to second shots. Next week, we have more than 900 second shots that we need to give. So we're averaging for the last several weeks about 1,000 doses that we give. If we could get more product, we could give more vaccine shots. We're reliant on the state right now for both the registration and the scheduling of our shots. In the beginning, the state website wasn't up and ready, so we were doing the scheduling manually. We're now reliant on the state for the website, so if you haven't gone in and registered vaccinenm.org, do that. That's the first step that you need to take. Then, when you are eligible, you will receive a code from the state. So in the beginning, we were the ones doing the scheduling. That has changed now. The state is the one sending out the notification. And as of today, the 28th of January, the rules are phase 1A, that would be healthcare workers and others providing care, for example, those at the Taos Living Center, the Taos Retirement Village, immediate responders, those sorts of folks are covered in 1A. And then 1B1 is the other category, and that would be individuals 75 years or older, or the other half of 1B1 is individuals greater than 16 years of age that have at least one health condition, diabetes, high blood pressure, obesity, those sorts of things would qualify someone greater than 16 years old. If you don't meet those qualifications and you don't work in the jobs that I mentioned, you're not going to get the code from the state right now. So I said this in a radio interview recently, please be patient. We have the capacity to give a lot more doses. We have to wait until the state can get it. I'm told that it may be 3 to 4 weeks before the state numbers go up. So I urge the community to be patient. As soon as we get the product, we will get it out using the state website. So go online, get registered, and then look for that notification from the state. As soon as we can, we'll get you the shot that you need. One of the things that we've heard from the community is that, especially in the greater than 75 age group, folks don't have good internet access, or they're not comfortable with the technology needed to access the internet. Have to get on the internet to get to the state website. So the state has a 1-855 number that you can call, but there are a lot of people trying to call that number, and the wait times are long. So Holy Cross is trying to come up with a solution, and we actually are putting together a process where people who have a phone, whether it's a landline, whether it's a cell phone, but they have a phone, we can help them get signed up. We can help them get scheduled. So there's a new number that we've created. Call that number and we can help you if you're not able to get registered on your own. This is another way that Holy Cross is trying to help serve the Taos community. Thank you.